Today, I'm going to tell you 3 stories from my work and highlight why data can be a powerful force for change. These 3 stories are going to center on important aspects of our society. Let me start with the first story and begin with an anecdote. On the slide, you see an image. It was a video back in 2017 that became viral. And this video was shared so widely in India, it led to panic and subsequently mob lynchings, leading to several innocent people's deaths. Later, it turned out that in fact this was an edited video and was shot in Karachi, Pakistan. And ironically, this was a public service message which was there to inform the society about how easy has it become to kidnap children. I ask you, how many of you have ever questioned the source of a news article you've read online? I'm sure almost all of you would have done that. And you're not alone, of course, in this. So research shows that misinformation travels faster than true information. And it poses a real threat to our society. Therefore, it's really important to actually fight misinformation through technological and educational interventions. And that's exactly what my group at LUMS has been doing for almost the last decade. So the question we asked ourselves was, how can we fight fake news? And the answer lay in data. So the first story is about this journey. Back in 2017, Facebook and WhatsApp published news articles on many countries about how to fight fake news. They published these tips for spotting fake news. Many of you might have come across them. And the first question we asked was, how effective are these tips for spotting fake news? Are they really making people informed consumers of news? So we launched the first randomized control trial in Pakistan on learning about whether these tips were effective or not. We reached 1,500 households covering 7 National Assembly constituencies in the city of Lahore. And our enumerators, reached out to all the households on the foot. And what were the lessons learned? Really, the results were eye-opening. Just tips for spotting for fake news had no effect. However, when combined with feedback, it led to a 10% increase in the improvement of accuracy judgments of people. Now, that was a big result for us because that meant that media literacy can actually work, provided it's contextualized based on the target population. And not only it helped us in understanding the problem, but this could be scaled up at the national level. And as a result, subsequently, our team won the Facebook Integrity Research Award, along with Dr. Aisha, who co-led this. And we were the only 11 global recipients, 2 outside the United States, who won this award. Next year, along with my fantastic colleague, Dr. Aghali Raza and Dr. Aisha, we again won our Facebook Integrity Award for our work on countering deepfake misinformation. And for the third year, we won another award for gamification of misinformation. Again, this was an award out of, we were 11 global awardees out of 503 proposals that were received by Meta at the time. USAID recognized our work as one of the most notable works in the Global South for fighting fake news. And we were also recently covered by Voice of America for our research on misinformation. My second story talks about agency and protecting our young children. Let me ask you a question. How many hours do you think an average child spends on smartphone? It turns out that it's 4 to 6 hours. An interesting question to ask is, what are they really watching? And it turns out that YouTube is very extensively watched, and it makes up 2 hours of the average time kids spend online. Why do I mention about YouTube? YouTube is a playground for fun for kids, full of educational content. And many of you must have come across channels like Cocomelon or Ryan's World or Blippi. Now, imagine a child who's watching a video and suddenly is interrupted by an ad of gambling, for instance, or violence or suggestive content. Now, such a content can have large consequences on the behavior and development of children. And we were observing this far too often in our homes. So my colleague, Dr. Zafar Qazi, and I decided to bring data evidence to this question. So what we did was we streamed 1,500 videos, 1,500 most popular YouTube videos from 10 countries across the globe and collected more than 24,000 ads that appeared on those videos for kids' content. We looked at 10 countries, 5 high policy countries like the US, France, Germany, Sweden, and the UK, where you have regulations. For instance, in Europe, you have GDPR. In US, you have COPPA, which protects children under the age of 13. And we also looked at low policy countries like Pakistan, Bangladesh, Sri Lanka, Venezuela, and so on. And recently presented this work at the WebConf, which is a premier venue on the web. And what were the learnings? Here is the punchline, and which is very unfortunate. If you are a kid in Pakistan, you are 8 times more likely to be exposed to inappropriate ad content on YouTube. This has far-reaching ramifications for our children. And so by using this data, we can inform policy and also bring about educational interventions of what needs to be taught in the curriculum. My final story is about the elephant in the room, which is the impact of generative AI on different sectors. So we all know that large language models like ChatGPT, Claude, Gemini are changing the future of work. According to the recently released report by the World Economic Forum, 39% of core skills are going to be changed, across occupations are going to be changed by AI by 2030. And really the big question we are asking is AI a complement or a substitute? Right? And to answer this question on a single vertical, we've zoomed into the healthcare sector, which is a critical sector for any society. And so we asked, can ChatGPT, for instance, be a complement to doctors? And why this matters, because diagnostic errors by doctors makes up a leading cause of preventable harm. In the US alone, 12 million people are affected by diagnostic errors. So we decided to bring data to this question at LUMS. So we conducted the first randomized trial of medical doctors in Pakistan, and what we did was we randomized the doctors into 2 groups. The treatment group, they were provided access to ChatGPT, and in the control group, they were provided access to conventional resources that the doctors use anyways. And each doctor was asked to solve 6 complex diagnostic cases in 75 minutes of time. And all these doctors were trained by us on health data science and health AI. What were the results? What did we learn? The results were startling. People who were in the treatment group were provided access to ChatGPT had 37 percentage points higher diagnostic accuracy as judged by medical doctors compared to the control group. And this is very encouraging in some sense, because now preventable harm due to diagnostic errors can actually be addressed provided these doctors are adequately trained about the strengths as well as the limitations of generative AI. So here is what I want you to take away from my talk. In today's world, the ability to read, interpret, and use data is a superpower. And I encourage you all to actually have developed that superpower. And all the examples, 3 stories I shared with you, are stories of how data can drive meaningful change. So I leave you with the following challenge. Look around you. What problems do you see? And in those problems, how can you use data to solve them? And maybe you might think that it's a very small kind of project in the school or a community issue. No issue is small. Just think about what kind of data can actually bring meaningful change. Go collect that data and do interventions of that kind. So with that, I'll conclude here, and I wish you all the best for creating meaningful change in the society. Thank you.